The Dr. Bawa Garba case involved the death of a 6-year-old boy, Jack Addock, in Leicester Royal Infirmary. And following this, there was a GMC case against Dr. Bawa Garba. The legal battle that ensued was a bit more prolonged than the Charlie Gard case, and there were a few sort of alternating decisions in it. So I'll read out a summary and then we can discuss the potential questions that could come up in the interview. On the 18th of January 2011, 6-year-old Jack Addock had been feeling unwell. He was having difficulty breathing with vomiting and diarrhea. He had Down syndrome and a known heart condition which required long-term medication. He was admitted to the Children's Assessment Unit at Leicester Royal Infirmary following his GP's referral. Jack's condition deteriorated and unfortunately he passed away. He was seen by the junior doctor Hazida Bawa Garba, paediatric registrar who was ST6, so she was a couple of years away from completing her training as a consultant. A High Court case was taken against her on the 4th of November 2015 and she was found guilty of manslaughter and gross misnegligence. Going through it, we'll go through the mistakes that Dr. Bawa Garba was found guilty of having made in court. When Jack was admitted, Dr. Bawa Garba ordered a chest x-ray that showed an infection. The x-ray results were available from 12:30, but they didn't get seen until 3 p.m. They then prescribed antibiotics which were administered at 4 p.m. It's important to understand that prescribing antibiotics earlier could potentially have led to a different outcome, but the ward was understaffed and Dr. Bawa Garba was extremely busy. Furthermore, she had not been made aware that the x-ray result was available at 12:30. A blood test revealed a high CRP, which occurs during an infection or inflammation. This was reported over 5 hours late due to failings in the healthcare computer system. When Jack was assessed by Dr. Bawa Garba, she stopped the medication for his heart condition. However, she did not document this in the notes, and subsequently this medication was administered to Jack at 7 p.m. by his mother. Jack's mother was unaware that he had not been following the usual course of his treatment for his heart condition. Jack suffered a cardiac arrest at 8 p.m. Dr. Bawa Garba was one of the doctors who attended the call and arrived when resuscitation was already taking place. Dr. Bawa Garba mistook Jack for another patient whose notes were marked as DNAR, do not attempt to resuscitate, and therefore Dr. Bawa Garba called off resuscitation. Resuscitation was continued shortly after the mistake was identified and Jack died at 9:20 p.m. So there are a few failings within the hospital system of this case. So prior to the 18th of February, Dr. Bawa Garba had an exemplary record. She had also just come back from maternity leave. While mistakes were made by Dr. Bawa Garba, there were also issues within the hospital system which contributed towards the negligence in the care provided. Notably, these are Dr. Bawa Garba was carrying out the work of 2 doctors in the hospital which was extremely understaffed. Senior consultants were not on site and therefore Dr. Bawa Garba did not have anyone to report to and there were not enough senior nurses on the ward. The failings of the hospital computer system prolonged the receipt of blood results. The nurses didn't identify Dr. Bawa Garba that Jack was deteriorating. The administration of Jack's medication for his heart condition was not carried out by Dr. Bawa Garba. And these are important things to consider when we are evaluating the case. And then the ensuing legal battle. So after the sentence in 2014, Dr. Bawa Garba appealed her sentence and the following occurred. In 2016, the appeal was denied by the Court of Appeal. Several doctors were outraged by this decision and felt that the court had not taken into consideration the working conditions of the NHS and the lack of support for junior doctors. There was a 12-month suspension. The court resulted in Dr. Bawa Garba being suspended for 12 months from the GMC, from the medical register, and the GMC applied to have her permanently struck off from the medical register. However, the Medical Practitioners Tribunal Services refused this application, stating that erasure would be disproportionate. In 2018, January, the GMC controversially appealed against the Medical Practitioners Tribunal Services decision in the High Court. The appeal was successful and resulted in Dr. Bawa Garba being struck off the General Medical Register, preventing her from working as a doctor. Following the public outcry from junior and senior doctors, a crowdfunding page secured funds for Dr. Bawa Garba to continue her fight. In March 2018, Dr. Bawa Garba was granted leave to challenge the erasure from the Medical Register in the Court of Appeal. In March 2018, Dr. Bawa Garba was granted leave to challenge the erasure from the medical register in the Court of Appeal, and she won her appeal against the 12-month suspension and was then reinstated. And then in November 2018, the Doctors Association UK launched a Learn Not to Blame campaign in an attempt to create a better culture that promotes learning from adverse events and focuses on fairness and openness of both patients and NHS healthcare professionals. In April 2018, the Medical Practitioners Tribunal deemed her to be a low risk to patients, and Dr. Bawa Garba was cleared to begin practicing again. The 2-year practice period began in July 2018. In February 2020, due to a lack of patient contact since 2015, Dr. Bawa Garba had returned to work in a lower grade than previously employed. Medical Practitioners Tribunal ruled that Dr. Bawa Garba is now fit to practice without restrictions. So when answering questions about this case, and there are a fair few details to it, the overarching themes here are one of a system where there were many inadequacies in the way that the hospital was being run, and 2, there were mistakes made made on the part of Dr. Bawa Garba. The end outcome of the investigation was an overturning of the decision that was made. However, the long battle throughout it led to some doctors within the medical community feeling that there wasn't an appreciation from the GMC of the system that doctors were working in, and how sometimes there is understaffing and various other issues that leads to difficulties in providing top quality patient care to each patient that they see. So when answering questions on this, don't be too critical of the GMC. At the end of the day, it is the one single body that we have to protect patients and give guidance on doctors for how they practice and regulate the conduct of doctors. So it's a very, very important process. You are more than okay to mention how there were difficulties in the hospital and that those affected Dr. Bawa Garba's decision-making ability, and potentially this was overlooked by the GMC in the initial hearing, which was eventually overturned. I think that that would be the best way to phrase it, because at the end of the day, both parties, both the GMC and the Dr. Bawa Garba and her supporters, they were all trying to do the best at their jobs. It's just that there was a long legal battle that resulted from it.